Good morning, I am Dr. Anwar. I am an internal medicine specialist working in Allevia Medical Center.
Hi, I am Dr. Naufal Rizwan, also an internal medicine specialist at Allevia Medical Center.
So today we will be discussing few things about diabetes, which is a very common chronic disease. Diabetes is a situation in which your blood sugar remains chronically elevated. And Dr. Rizwan would be giving us a little more insights into the types of diabetes and how it behaves.
See, coming on to the types of diabetes, there are mainly two types, the type 1 and type 2. The type 2 usually occurs in people who are more than 35 years of age. Of course, this is the most common type of diabetes, like more than 90% of population suffer only from type 2 diabetes. And type 1 diabetes usually occurs in younger age group, usually less than 18 years of age. So, sir, can you just add upon something about this type 1 diabetes?
We have to, when we are talking about the diabetes, there is few things we will, tell you in, as a basic, I think. So, we need insulin. Insulin is produced in our pancreas. There are types of cells called beta cells which produce insulin. Insulin is needed for letting the glucose enter the cells. Without glucose entering the cells, cells cannot function. So basically, insulin does help or let the sugar into the cell. So what happens in type 1 diabetes, the beta cells which produce insulin are destroyed. So we don't have insulin. That is the situation in type 1 diabetes. So type 1 diabetes is a situation in which there is hardly any insulin.
This is in opposite to the type 2 diabetes.
Exactly, sir.
Yeah, because in type 2 diabetes, if you see, the insulin is produced, but the problem here is the action of the insulin. Even though our body produces insulin, it is not acting properly, and this we called as a insulin resistance. So coming on to the symptoms, how do you actually diagnose a patient as a diabetes with the symptoms?
Yeah, basically, there are a lot of classical symptoms which has been described in diabetes. A little bit it may not be asymptomatic itself. See, generally in type 1, the symptoms are very much pronounced because there is an insulin deficiency.
Yes.
So generally there may be means the patient may feel always thirsty, the patient may become very thin, that's losing too much of weight, and may have recurrent infections, may get hospitalized for infections, they may develop some curious situations like ketoacidosis and all, and generally these patients are very thin patients. Okay. In comparison with the type 2 diabetes, people which may have, as you rightly had put it, there is an insulin resistance. We may find some symptoms like more urination, more thirst, or maybe loss of weight also in the later stages. We may find some evidence of insulin resistance in the sense of some skin tags in the neck, like velvety, type of skin lesions in the neck. We call it as acanthosis. So,
but mostly they remain asymptomatic.
Exactly, sir.
Type 2 diabetes.
Generally asymptomatic. Would you like to tell me more about, how do we diagnose the diabetes?
So diabetes, of course, it's detected diagnosed only by the blood test. So there are two types of blood test. One we call as a fasting and a postprandial blood test, and the second one is the HbA1c, that's we call as a glycated hemoglobin. Coming on to the fasting blood sugar, see, the patient should ideally be in a fasting state for at least 8 hours, okay? And then they have to give the blood, and if the blood sugar is like more than 126 or more than 126, then the patient is a diabetic. Also what we do is we give a 75 gram of glucose and tell the patient to drink that, and exactly 2 hours after that we will check the blood sugar again, and if it is 200 milligrams or higher, then again the patient is called as a diabetic. And what is the advantages of a HbA1c test, sir, that we normally do?
So basically, what is HbA1c? HbA1c is our hemoglobin in the red blood cells. They become attached with the sugar,
yes,
and we can measure it. So it gives us a level of our blood sugar in the last 2.5 to 3 months, depending on the life of the red blood cells, of course. And why is it important? sir, you really put it as the patient has to come 8 hours fasting, or maybe take 75 gram glucose. It becomes a little cumbersome.
Yes, yes.
It is a little difficult for the patient. So what this thing, you can take the blood sugar anytime and you measure it, and any value more than 6.5, yeah, it's basically percentage, more than 6.5 percentage, we can diagnose that this gentleman is, or the madam is having diabetes.
So anytime they can just
Anytime,
drop in, they can
drop
just give a blood test for HbA1c, and within 30 minutes will get
generally it takes around very less time to get a
So that would be an ideal test for those who cannot come in the fast.
The actually random blood sugar or the blood sugar measurement takes much more time than the HbA1c, which usually comes within 10 to 15 minutes.
Yes,
so it's a very easy test.
Easy test, good. So what are the usual complications of diabetes? Okay, a patient is having diabetes, assuming that he has not tested, and what are the complications that can happen if the diagnosis of diabetes is not made at the right time?
See, we have to understand that, likely we had said it, there may be acute or the urgent emergency immediate complications, and there may be long term complications. Yes. The immediate complications are like increased propensity of infections, yes, having some skin infections in the penis, we call it as melanoposthitis, or may the patient have visual abnormalities due to the swelling of the lens in the eye. There are some acute complications like ketoacidosis, as we said, like it's a type of biochemical situation in which
emergency situation.
Yes, yes. And there may be a long-term complications, like we can think this as diabetes as a disease affecting the blood vessels, or vasculopathy,
yes,
as the blood vessels. So there may be affecting the small blood vessels and large blood vessels. Small blood vessels we call it as micro, and large blood vessels we call it as macro. So macrovascular and microvascular.
So what are the macrovascular complications?
Macrovascular is actually we can the blood vessels affecting the heart, supplying the heart, they can get narrowed due to long-term blood sugar.
Yes.
Yeah, there are other compounding factors for elevated blood pressure, elevated cholesterol levels, hypertension, all these things add on to this. But the blood vessels may become narrowed. This blood vessel narrowing, if it is in the large blood vessels, we call it as macrovascular.
Yes.
So it could be narrowing of the coronary artery or the vessel supplying the heart.
So heart can get damaged if the diabetes is not diagnosed.
Exactly. There are maybe direct effect on the muscles of the heart, or it can narrow the the blood vessels to produce low flow into the the muscles of the heart, leading to heart attacks, anginas, or the chest pains on walking, or it can produce it can affect the brain to produce strokes, or it can affect the legs, limbs to produce diabetic foot complications like that.
So these are the usual macrovascular.
These are the usual.
So microvascular, if you take, it can affect the eyes. So diabetic patients, if it is uncontrolled, it can definitely lead on to vision loss. So that's one important organ which you always test. And of course it can also affect the nerves and the kidney. These are the three usual organs that can get affected by diabetes: the eyes, the nerves, and the kidneys. Okay, so now a patient has come, we have tested, and how do you treat actually this diabetes?
See, basically treatment of the diabetes, first we have to understand how to treat and why to treat.
Yes.
Why to treat means diabetes generally doesn't lead to any acute complications generally. So why do we really treat? We have headache, patient will come and with headache because he has pain or he has issues. Diabetes generally is symptomatic, so nobody is really bothered.
Yes.
So this produces complications over a period of time. So there is a latent period of around 10-15 years. Down the line you develop complications. So when you are healthy, you don't really feel like you need to treat. So basically keeping the blood sugar normal, regularly checking the blood sugar, and taking the medications as and when prescribed in a regular basis in consultation with your doctor. These are the three things. So keeping your blood sugar can be done by different methods. Actually one is not exclusive to other, it is basically complementary. So you need to exercise, you need to control your diet, and you may require medications. Would you like to tell us a little more about the diet and exercise?
Yes, diet is a very important part of a diabetic management. For example, each food has got a value we call as a glycemic index, and any food which has got a high glycemic index, diabetic patient cannot take it. I'll just give an example: potato, mango, banana. These things and all have high glycemic index.
We Indians and Pakistani people, we have huge attraction towards mangoes.
So the diabetic patients, they should not eat these things. So they should know what are the foods they need to avoid. Of course, all these things the corresponding doctor will tell them. So stopping these high glycemic index foods is a must for all diabetic patients.
That is the basic.
Yeah, that's the basic thing. And second is about the exercise. As you rightly told, minimum 30 minutes exercise a day. Let it be a jogging or running or doing in the gym, whatever it may be. They have to work for a minimum of 30 minutes a day, at least 5 days in a week. And when they follow a proper diet, good exercise, and as he told, the proper medications given by the doctor, the diabetes will be under very good control.
I tell my patients generally diabetes is like a bad spouse. You have to live with it. You have to adjust with it and live with it, right? No?
So when they follow these three things, the diabetes will be under very good control. No, in fact it's on the reverse. Like a diabetic patient cannot eat a high sugary foods, because as just now I told you, any food which has got a high glycemic index they should avoid. Whereas if their insulin production is good, a normal patient can have a moderate amount of a sugar intake, because whatever they eat, our body produces insulin and the sugar will be under control. But anyways, when you take a lot of sugary items, so it all produces just empty calories, unnecessary calories. So try to restrict that and have a moderate amount of sugary items.
See, this is a very curious thing. See, borderline diabetes, we call it as, when the blood sugar is between fasting blood sugar, as Dr. Naufal had put it, the fasting blood after 8 hours, you have the blood sugar in between 100 to 126. You call it as impaired fasting glucose or pre-diabetes. Or when after food you find your blood sugar is in between 140 and 200. Again you call it as, it is pre-diabetes. Pre-diabetes is not as innocuous as you think. This is the time when you can really intervene and prevent diabetes. So basically you may not require any medications, but a huge lifestyle modification may alter the whole course of the disease. You may not have the disease at all. So you can intervene, like, you go for regular exercise, go on healthy diets, and try to bring down your sugars to normal, do an SBA1C once in 3 months or so, and this will go a long way. Actually, there is something called a legacy effect, in which if you control your pre-diabetes in a very strict manner, the effect may remain there for years to come, even if you stop treatment after some time. So even if you stop intervention, I will say not treatment, like your dietary intervention or exercise intervention, if you stop it for some time also the effect remains. So it is very important that you intervene at that point of time.
So no, not all overweight patients have diabetes. I have got so many patients who are obese and their sugars are always perfectly under control. But it is one of the risk factor for diabetes, for developing diabetes. Whenever the patient is like overweight, there are high chances of insulin resistance in that patient. So over a period of time, if they don't lose weight, and they may end up with diabetes. So other factors also we have to take into consideration, like for high cholesterol and diet, and if they are able to control all these things, they may not end up with diabetes. But having said that, all obese or overweight patients, they need to do regular exercise and then bring the sugar under normal values.
Well, this is a very important question, and it's a very misunderstood point. Now, it is not the diabetic medications which produce the complications, but it is the long-term diabetes, uncontrolled diabetes, which leads all sort of complications. Blood sugar medications, whatever they do is to bring the blood sugar level to normal so that you don't develop complications. Over a period of time, see, I told you from the beginning itself, diabetes is something which produces complications over a period of time. So basically, if you don't treat the diabetes also, the complications start coming in after a latent period of 10-15 years. But if you are on regular with medications, if you are bringing, if your blood sugar remains always normal with medications, I am saying with medications, then chance of developing the heart attack, strokes, and as Dr. Rizwan put it, kidney diseases, neuropathies are it becomes very less. It is even said that you can even 100% prevent the microvascular or the complications related, diabetic complications related to the kidneys, eyes and nerves. So, this is very important point. It is not the drugs which produce this thing, rather it is the diabetes which produces. See, diabetes, as we had rightly put it when we have been discussing, diabetes is something which you have to live with. You have to live with to prevent complications, and it is not nothing to be feared, but it has to be tackled in a nice way by your diet, exercise, and with or without medications, depending on the blood sugar level. Blood sugar level actually defines how your diabetes is going to behave or how you should treat diabetes. Right now?
Yes, as I already told, only 4 important points. So these are the 4 points which you want to again reinforce again and again: diet, regular exercise, medications, and periodic blood sugar checkup.
Exactly.
Follow these 4 things and diabetes will always be under very good control. Thank you.
Thank you.